Having diabetes doesn't mean that you can't go abroad, it doesn't mean you can't go on a holiday of a lifetime or even just a quick trip abroad for a city break. The important thing to remember is if you want to be relaxed and have an enjoyable holiday, it's just the preparation that you need to go through beforehand. So there are certain things that we would suggest that are worth thinking about. So the first thing is to make sure that you have a letter either from your GP or from your diabetes nurses to say that you've got diabetes and what insulin, what medication and what equipment you may need to carry with you so that you can show that through security when you go through to check it. One thing to consider well in advance of your holiday is whether you're going to need any vaccinations for your destination. Some of these need to be taken several weeks or several months before you travel. So finding out well in advance of your holiday what vaccinations you need and arranging those through your local surgery is really, really important. Before somebody travels abroad, if they contact Diabetes UK, they can find out information about similar organisations in the country that they're going to. But if they also take the contact number for their own nurse or clinic in case they've got a quick query that they can make a call from abroad, so they've got those numbers available should they need them.
To contact Diabetes UK Careline, telephone 0345 123 2399.
It's a good idea to take the repeat prescription that you have from your GP when you're travelling abroad, because if you do have your medication stolen or lost, then it's really useful to be able to show that to a local doctor so that you can make sure you get the right medication.
You would take your insulin, you would take sufficient needles, obviously, because we have pens, which I fill myself with cassettes and have a fresh needle for every injection. Obviously my testing gear, and if you're like me, you have one in reserve as well.
Your hand luggage is a really vital piece of equipment when you're travelling, especially if you're travelling abroad and you're flying. Your hand luggage should contain all your essential supplies in order for you to manage your diabetes. So your insulin, if you take insulin, and a spare insulin pen, all your injection needles, all your blood testing equipment, all your hypo treatments, and your repeat prescription, your insurance certificate, your vaccination certificates. All of these things are really important for you to manage your diabetes effectively when you're on holiday. But if you split them between your hand luggage and the hand luggage of your travelling companion, then you know that if one bag gets stolen, you've still got enough supplies for your holiday in the other bag. And that's really good planning. Once you take insulin out of the fridge and you start to use it, it has a shelf life of 28 days. So if you're travelling abroad and you're going to be away certainly for more than 28 days, then you need to discuss with your GP about having supplies for a longer holiday. If you're travelling for more than 3 months, then you certainly need to find out how to obtain that medication when you're abroad, because the NHS only has an obligation to provide you with 3 months medication at a time. If your time zone is more than 3 to 4 hours difference from the UK, then you may need to discuss with your nurse or your doctor before you go about how to manage your insulin injections around those time zones. And also if you're on a long haul flight, there are certain things that you need to be aware of on a long haul flight so that you don't over inject or inject too frequently. Storing your insulin when you're travelling could be quite a problem, especially if you're in a very hot country. So using a cool bag of some kind, like a Frio bag, will help you to keep your insulin at the right temperature for a 2-week holiday or a 3-week holiday, so that you won't need to discard that insulin when you come home. The other important thing to remember is to make sure that when you do travel, you have at least twice as much medication as you think you're going to need for your trip abroad, and that you have twice as much testing equipment as you think you're going to need, and that this is always carried in your hand luggage and it should not go in your suitcase in the hold. There are 2 main reasons for that. The first is that you might end up in Tenerife, but your luggage might end up in Timbuktu. But also, if you're carrying insulin, insulin will freeze in the hold of the plane at 37,000 feet, and then it won't be reliable when it thaws and you need to inject it. So carrying that in your hand luggage is absolutely crucial. The other thing is to make sure that you have treatments for low blood sugars, so that you carry hypo treatments with you. Now, lots of people carry orange juice or little cans of cola or fizzy drink, but of course those will be too big to take through security. So you need to think about your hypo treatment that you take and maybe use some form of glucose tablet or some form of jelly sweet rather than a liquid, which is maybe going to be more than 100 mils and not allowed through security. The other thing is to make sure that you have an information leaflet that you keep in your hand luggage about what to do if you become unwell. So it's what we call sick day rules. If you've got sick day rules information with you, if you do become unwell, then you've got some information to hand to know how to deal with it. It's also a good idea to find out what your medication is called in the country that you're going to, so that if it does get lost or your bag gets stolen, you'll be able to get hold of that really quickly. As well as your own travel insurance, which is an absolute must, it's also the European Health Insurance Card, the EHIC card, which has replaced the E111 form. Make sure that you have that it's up to date, and that you remember to take it with you. And that will ensure that if you do need help abroad, within Europe at least, then at least you'll have access to that help straight away.
To apply for the EHIC card, go to www.ehic.org.uk or telephone 0300 330 1350.
If you're travelling with friends or travelling with family, they'll know that you've got diabetes, but it's really important that they also know what to do should you have a very low blood glucose, or they know to call for medical assistance should you have very high blood glucose levels and be really unwell. If you're travelling with a group of people you've never met before, particularly if you're on an active holiday, it's really important that you tell at least the leader of the group that you have diabetes and make sure that they know what to do should you have a problem. Heat can also drop your blood glucose levels. So if you're going somewhere very hot and you're going to be sunning yourself on the beach all day, testing your blood glucose more often than you would do normally for the first couple of days will help you to see very quickly whether you need to reduce your insulin if you take insulin, or whether you may need to just increase your carbohydrate intake slightly if you're on tablets. It's always good to know that if you're travelling to a country where the water may be a problem, is to make sure that you have access to bottled water that you know is safe, so that you're less likely to get a tummy bug or an upset stomach. We normally recommend, even at home, that people with diabetes don't walk around with bare feet. On holiday, the hazards can be greater because the sand can be really hot. There can be hidden hazards in the sea. So if you end up burning your feet or cutting your feet on something sharp in the sea and you end up developing a foot problem, that could be quite difficult to manage. So making sure that you don't go around in bare feet and that you do look after your feet when on holiday is a really important thing to remember.